President.
Well, first of all, thank you. You're doing one heck of a job. One of the things that when we started to try to figure out what we were going to do when we came into office, because there wasn't much of a transition, we didn't have, we weren't given a lot of information. And some of the information we had turned out not to be accurate in terms of vaccine supplies. And we met virtually with all the governors. And the governors basically said, just send us the vaccine, we'll take care of it. And the fact is, I think they and everyone else vastly underestimated the logistical needs that go with having the vaccine, assuming you have enough vaccine. And so one of the first things we did was called in FEMA and also contacted every governor general and told them that we'll pay for the National Guard. It won't be their expense because you guys are and women are badly needed. And in addition to that, the Defense Department has allocated over 1,000. They're going to go up to 100,000 people who are going to be helping along, 10,000 people who are helping along the way. So I just want to thank you for the coordination. I mentioned this to Dr. Crystal earlier, but the coordination is really, really matters. And we've got people who know what they're doing, starting with a doc and you two both with FEMA and well as the National Guard. That's your business. You know how to get it done. And so, and you are really doing it. I just think what you put together is amazing. Our hope is that we're going to be able to not only keep the commitment to get 100 million shots in people's arms by the first 100 days. I think we'll exceed that considerably, but also we've now been able to go out and talk personally with the vaccine manufacturers. They've upped significantly the commitments to the amount of vaccine they'll produce and when it will be produced. And so things are beginning to click. People are beginning to feel that they can find their way to get the vaccine. And lastly, one of the most important things for us, and you mentioned what's happening on the Navajo tribe, I've met with the leaders, is that it really does matter that we have access to the people who are most in need and most affected by the COVID crisis, dying at faster rates, getting sick at faster rates, but not being available, not being able to get into the mix. And so equity is a big thing, and I want to thank you all three of you for engaging in that. But we're going to hear from, I'm going to turn this over to the Vice President, but General, I hope we're going to hear from you as well after the Vice President says something to whatever she wants to say, okay?
Thank you, Mr. President. Just a quick question. Ms. Luttrell, can you talk a little bit about what you think will be the challenges in terms of the mobile units and what will be the strengths of that? Because again, we're going to be watching these first rollouts as a model for what we do in other places. So from the ground, what do you see as being the challenges and the strengths of that operation around mobile units?
Sure. I would start with the strengths only because I've talked to our CDC partners and the public health professionals, where at first I thought we were going to have, be using or depending upon our mobile command vehicles out of our detachment, our MERS detachment out of FEMA, which they are still going to assist and help us because they have the means to technology where we could take on the road and then also be able to allow those who need to enroll be able to do so at ease. But after talking with CDC and the public health professionals, they educated us and let us know that there are mobile operations within the public health sector that are really good at mobile operations. So we're going to maximize as much as we possibly can and not just lean on our own understanding or our own FEMA resources in order to go mobile. So a lot to learn still, but we're staying optimistic that we're going to once again be able to come together and be able to reach those who need us the most.
Hey guys, did you know we have a podcast called WJ Live?
The Western Journal's mission is to equip readers with the truth, and that's the same mission we have on WJ Live.
You'll hear from writers, editors, and special guests on the most important topics of the day.
You can watch us every day at 5 p.m. Eastern, 2 p.m. Pacific on youtube.com/WJ Live.
While you're there, help us out by subscribing and hitting the bell so you don't miss any future episodes. See you there.